of all, if you look globally, lung cancer is the most common cause of cancer-related deaths. It's similar in Malaysia. Among men, lung cancer is the second most common type of cancer, just slightly behind colon cancer, but it's still the deadliest form of cancer. Among women, lung cancer is the fourth most common type of cancer, but the second commonest cause of cancer-related deaths, just behind breast cancer. Lung cancer in our region is different from what it is in the West. We are seeing an alarming rise in the prevalence of lung cancer among non-smokers, especially women. So smoking in Malaysia is still at a high rate. About 43% of the male population smoke compared to about less than 2% of women. But if you look at the incidence of lung cancer, 60% of women diagnosed with lung cancer have never smoked, meaning that lung cancer is more common in never smokers in women compared to smokers. So, just simply put, it's no longer a disease of male smokers. So, there are some important risk factors for lung cancer non-smokers, and this is mainly age, a family history of lung cancer, a personal history of other types of cancer, exposure to indoor and outdoor air pollution, exposure to environmental carcinogens, and if you have underlying lung diseases like tuberculosis, lung fibrosis, or COPD. There are few theories as to why women are more susceptible to lung cancer, and some of it is because of differences in hormonal responses and also differences in immune responses. It is thought that chronic cumulative exposure to air pollution, particularly your PM2.5, activates these dormant cancer-causing genes like the EGFR mutation in genetically susceptible patients. So EGFR is much more common in Asia than it is in the West. And if you have more family with lung cancer, then your risk increases accordingly. So lung cancer for the majority of patients are asymptomatic. If they are picked up early, it's because it's been incidentally picked up on a scan done for other indications. When symptoms do arise, it's often when lung cancer is at a later or more advanced stage. So if you're a non-smoking woman and you do have risk factors, the gold standard for screening is a low-dose uncontrasted CT. Having said that, even something like a chest X-ray can often suffice. One of the things people are worried about when we mention CT scans is the risk of radiation. The low-dose CTs that we do have minimal radiation and have not been shown to increase your lifetime risk of cancer, so they're quite safe to have. In Malaysia, there's this misconception that lung cancer is mainly a disease of smokers and only happens in older people. But what we are seeing is an alarming rise of the incidence of lung cancer in younger people who have never smoked. Other barriers include fear of cancer diagnosis, the stigma associated with it, the fear of radiation, as well as the financial costs involved. So I think one thing to understand is that in Malaysia, 90% of lung cancer are diagnosed at a late stage, meaning stage 3 and 4. If lung cancer is detected early, your 5-year survival is about 70 to 90%. But if it's detected at a later stage, your 5-year survival drops drastically to only 5 to 10%. One interesting study to quote is one that came out of Pahang, whereby all the new lung cancer diagnoses in a single center were all late-stage cancers, and the average survival from point of diagnosis was only 18 weeks. So having lung cancer diagnosed early significantly increases the chances of survival and cure. The simple answer is yes. There are some risk factors, for example, exposure to second-hand smoke and exposure to environmental air pollution that we can't quantify. But there are certain risk factors that we can pinpoint, and this includes a family history of lung cancer, a personal history of other forms of cancer, if you've had significant occupational exposure, or if you have underlying lung diseases like tuberculosis, COPD and lung fibrosis, then please get yourself checked.